Looks great.
Great, wonderful. So, of course, it's a pleasure to be here talking to this audience. So, thank you for taking time on a Sunday to attend the session. My name is Surendra, and I'm also the Chief Product Officer of intelliH. About 15 years of experience working in intelliH, in healthcare. My focus was largely process and workflows in healthcare, really trying to understand, where the challenges were, both in the process side of the healthcare delivery, as well as on the experience side. So how do you basically transform the patient, as well as the care team experiences out there in healthcare? I started intelliH about 4 years back with my partners out here to build this comprehensive, virtual care and digital therapeutic solution. Largely based on some of the challenges that I saw within the healthcare environment as to how do you really manage these chronic patients outside the perimeter of your facilities out there. And that it was somewhere around the time that, the value-based care was basically becoming more instrumental in this environment. We know, as you saw during this COVID arena, that healthcare is now very quickly gravitating towards essentially a hybrid mode of delivery out here. And when you start looking at a hybrid mode of delivery, there's a variety of workflows that you have to really start, attending to. So when we did build this platform out here, we made sure that we took care of all the emerging trends in the delivery of healthcare services, whether it's remote patient monitoring, chronic care management, behavioral health, transition care, when they come off from an acute facility, virtual annual wellness visits, as well as, of course, the regular evaluation and management telehealth out here. So what do we have out here? We do have intelliH, which is actually lives in the SaaS cloud, and it's made available for mid-levels to start managing the patients. And we provide the patients with an app on iOS and Android app out here, which is available both on a phone as well as a tablet form factor. And for certain facilities, we've actually also given it on an autonomous robot out here. Now, the solution as it is used right now in a variety of healthcare settings out here. So we do have a acute facility that is actually a very large facility that is using this in a GDMT trial study right now for both HF and CHF patients out here. And their focus essentially is to make sure that there's an increased acceptance of those guideline directed medical therapy decisions that emanate from the solution out here. We have another large facility in Texas, acute facility in Texas, and they're using this particular solution essentially for their value-based metrics, reducing rehospitalizations, improving patient outcomes. We have a cardiac clinic that is actually using this again for CHF patients out there. We have a home health agency that is managing acute patients. And then we've got an assisted living facility that is using the robot within the environment to essentially start managing patients basically for HF and CHF, again, with the objective of reducing rehospitalization of the patients out there. The solution has actually been built to take care of conditions like CHF, COPD, diabetes, or even post-operative patients out there. When we actually look at this solution in a greater detail out here, we have provided what we call as stratifying patients by risk. So we look at the static risk when they actually come out of a hospital facility, and then based on the vitals that the patient is actually sending, we actually look at the dynamic risks that these patients are basically going through out there. And we provide the alerts and nudges to basically both the patients as well as the care team, the mid-levels out there, who can then proactively reach out to patients, start managing them, start monitoring them out there. and then making sure that there is a proactive intervention for these patients. Now, we do also provide the same app to a family member by consent, so that they also become a caregiver participant in essentially keeping the patient in compliance with the care plans that are actually built inside this solution out here. The intelliH is the solution that actually does the monitoring of the care plan, the compliance of the patient to the care plan, and does report non-compliance to all the participants in this care ecosystem of a particular patients out here. So if I actually look at the solution in a broader detail out here, one, of course, is making sure that we actually do understand risk from a clinical perspective. So we're not just looking at patients basically and identifying certain boundaries, let's say for systolic, diastolic, or heart rate, or diabetes measures out there for patients, but also to start really tracking clinical conditions and situations which we believe are leading to decompensation of a patient out there. And then the system of alerts is built in such a fashion so as to minimize the degree of alerts that a patient is essentially going to see when they are interacting with with the system out there. And our clinicians, our customers, basically really have told us that this has really helped them a lot in essentially being able to track patient outcomes, to be able to proactively reach out to the patients and making sure that they do not decompensate to a level where they have to basically get readmitted or have to essentially get hospitalized at any point of time or visit an ER there. So if the solution actually has a high degree of analytics inbuilt inside this thing. We do have, for example, correlations. So we can actually look at the correlation between a particular vital, a medication dosage, a group of medication dosage, medication compliance, as well as other risk factors, diet, for example. A very novel way of basically tracking diet. We understand diet is extremely complex for a lot of patients out there to start tracking out there. So what we normally do in our solution is allow the patients to take a picture of the food plate and describe what they're eating, and we calculate the nutritional value. And in a future upgrade, we are essentially going to try to even discover from the picture exactly what the patient is taking and the volume of that particular consumption that they're having out there, and then being able to automate the nutritional values for these patients out there, and then overlay that along with the vitals to essentially see if nutrition is also having an impact if the medication is static out there and not having that the certain impact out there. So the physician would know what to titrate, whether it's medication, whether it's activity of a patient, or whether it's nutrition out there, and make sure that there's a right intervention at any point of time. We do have what I call as single click reports out here. So one of the things that I've really done, and having worked in a lot of these hospital systems and looked at a lot of technologies out there, where there's, those technologies basically are built by engineers and they look like engineering solutions. I wanted to build a business solution out here, which was to be used by clinicians, by mid-levels, by patients themselves out there. So what we've done out here is to make sure that everything is single click, and we bring all the patient context automatically into a report or into the notes that could be generated out there and pushed into an EMR system. Now, we did use smartphones and smart devices out there. And initially, when we went into this particular process, the general thought process was that this is going to be very complex as far as, working with the population that we were actually going to be dealing with, the Medicare, Medicaid population out there. But to our surprise, we've actually found, a lot of feedback that is really coming from our customers. Our oldest patient is 93 years old. She used a smartphone for this particular this thing. And when I talked to some of my customers out there, the mid-levels who are attending, they basically said that she loves the technology. I mean, in the sense that we have what is called as a health tweet feature in our solution, where they can actually use to communicate with their care team members out there. And she says she's one of the frequent users of that care tweet, and they typically expect that tweet to come in. Essentially, I think what they feel is they feel connected. And that's the difference that I saw. So we did try, for example, a cellular-based technology initially out there, which said, we're going to avoid that population that is not familiar with the smartphones. But we found that, the smartphone, once they get used to it, they essentially love that particular technology because they believe, they feel very connected, particularly with the video-based interactions, the chats that they're having, and then those health tweets that they keep sending from time to time to these patients out there. On this particular level, of course, our essential focus is to basically make sure that we deliver both the outcomes as well as the patient experience and the clinician experience out there on the solution. Every new solution basically is looked with a very different approach in healthcare out there. It's always a challenge to get a new technology in. So if your focus is basically making sure that the solution is centered around the patient and centered around the delivery teams out there, I think there's a much more rapid acceptance of that technology. We've seen, and our customers have already started reporting the outcomes from the patient. They've seen much better patient satisfaction coming out of after the solution was introduced with them. They've seen outcomes improve. They've seen hospitalizations or rehospitalizations basically improve out here. So I'm going to stop out here to see if there are any questions. Thank you.
Wonderful. Thank you so much, Surinder. And of course, we do have some questions for you. You just showed us a tremendous amount of data that's being collected and processed. Could you talk to us? The question is, what kind of clinical team is needed to process all that information? And what kind of outputs are you putting out for the physicians, the cardiologists, et cetera?
Perfect. So yes, there is data that comes in from the devices, okay, and we do generate a lot of reports out here in our solution. So the data that we get is essentially the vitals. So it's whether it's weight, whether it's the heart rate, whether it's blood pressure readings out there, systolic, diastolic, or whether it's the temperature for patients that are actually post-operative also. Now, it varies from facility to facility. So the facility where we're doing a GDMT, they require patients to take 2 readings twice a day. So there's been at least 4 readings of blood pressure that come in every day, and the heart rate out there. The reports that we actually generate automatically is across any longitudinal period. And in this case, they want the report every week, Monday to Sunday. So we do generate, for example, the number of readings that were taken, the minimum value during that particular period, the maximum value that was during that period, the average of that particular period out there. And then we bring all the, so when we do generate this particular report with all these vitals out there, we do bring all the additional context, who's the patient, what's the age, what are the chronic diseases that they are basically undergoing, what are the last vitals when they measured, what were those vitals from a hypertension perspective or from a CHF perspective there, what's their, what stages were they in, stage 1, stage 2, stage 3, stage 4. We depict that graphically. We can list out the values even in a list format too.
Wonderful. Thank you so much, Surinder, for sharing with us what your solution is at intelliH.